So we offer our patients stem cell treatments, and then 6 weeks later we give them PRP. Now PRP is an abbreviation of platelet-rich plasma, and platelet-rich plasma is a blood-based treatment where we take off the blood. We take, depending on how many joints one needs to treat, we take off an appropriate amount of blood. We put that blood in the centrifuge again, and we centrifuge it down, and that separates the blood into its component parts. Now, the red blood cells we don't need and we don't use. Those have no business being in a joint space. Instead, we take off a little bit of the plasma, and we take out all of what's called the buffy coat layer, and that's the platelets, the white blood cells, and in the plasma then there's also some good chemical compounds, some healing factors. And what the research suggests is that if you inject PRP into or alongside stem cells, you will actually get an activation of the growth of those stem cells. And stem cells in and of themselves don't just become other tissues. They actually also have a very potent healing ability and an ability to cause the surrounding cells to do more efficient and more effective work. So we give our patients first a stem cell treatment, then 6 weeks later PRP, and then 6 weeks after that another PRP injection. Each of our injections are followed up with laser treatment. We've talked about that already, and it's worth noting that the early research on adipose-derived stem cell treatments suggests that these treatments will continue to regenerate and continue to grow for a period of between 6 and 24 months. That's a really, really good result for patients who come back to us at 6 months and almost universally have said that they are very satisfied and that they have almost or no pain, and really would recommend and would do the treatment again in a heartbeat. The reason that this is so impressive is because when we see them at 6 months and we actually then end our follow-up, officially at least, we know that those patients are probably going to have even more improvement. They're going to improve even more over the weeks and months that are to come, because the cells that have been put in are living and they're vital cells. Those cells are ready to work and they continue to work. There is no reason for us to think that those cells actually stop living and die. There just is no research that suggests that for now. Another thing that's worth mentioning then is that as this improvement continues, the first few weeks are definitely, there's going to be some discomfort. People often report that they feel discomfort and swelling and a bit of tightness in the joint, but that's usually because the body is working in there and there's an actual desirable inflammatory response. So finally, what then, or what else? If you take a regenerative treatment, can you be considered for surgery in the future? Well, yes, you can. But the opposite is not true. If you've had a surgical intervention with a prosthesis, then we cannot treat those with regenerative medicine because, of course, the cells we inject don't work on metal. And if you have a metal joint or a plastic joint in there, there's nothing for us to help the body regrow. These treatments are also currently being researched to give patients help or treatment within some other novel areas. So some people are researching neurological problems, some people are researching with things like diabetes, heart problems, kidney problems, and these are very exciting, but right now there's no good evidence to suggest that these would be anything more than early stage experimental treatments. When we get down to it, a regenerative treatment then is a treatment that is for the people who have tried conservative treatment. That is to say, they've tried maybe some painkillers and some training, they've lost some weight, they've stopped smoking, and they haven't had a desirable outcome. When we talk about surgery then is for the people who have what we call advanced disease. And if your disease is so advanced that you have daily problems with mobility and function, and you've been told that really nothing else is going to help, your joint is in such a bad way that an orthopedic surgeon recommends you get a joint replacement, then those are the people for joint replacement. We try to offer our treatments for people who have mild to moderate disease. We have on occasion had individuals who would like to be treated with us for advanced disease, and usually that's because they've actually personally decided they don't want a surgical treatment, but we don't actually recommend going against your surgeon's recommendations. If your surgeon has said to you, you need a new joint replacement, then they are competent to make that decision. Having said that, there are a few things about joint replacements that are worth noting as well. Some people have a misunderstanding of just how good or how bad these treatments are. Now, they are overwhelmingly better than they are There's more positive about these treatments than there is negative. But having said that, around 20% of patients treated with a joint replacement will actually have significant negative consequences, or will regret, or will not have the desired outcome. So that means that 80% of people are really satisfied with the treatment, but unfortunately about 1 to 5% will have serious side effects, and then the other 15% up to that 20, they will actually have felt that they didn't get the outcome they were hoping for. Now, we, like I say, try to offer this treatment for people who are in the middle of the spectrum. That is to say, they've tried their own treatment, it hasn't worked, and then on the other hand, the surgeon is saying you're too early. You're not in time for a surgical treatment, because we feel like these are people who have the right to choose to try something else and to see if this works for them. If you think you're in that group, or you know someone who is, send them a link to this video, and then drop us a comment down below if you want us to get in touch with you, and we will do that. We read through all the comments you write, so if you've questions, if you've something you want to bring up or mention, let us know, and we'll actually get back to you as soon as we can. Otherwise, I thank you for your time and your attention. I know this has been a long video. I feel like it's worth trying to get you up to speed with where we are, and although it takes a little bit more time, this video really is for those of you who are very interested and who have questions. Maybe you'll find the answers to some of those questions here. If you feel there's something we've left out, let us know. If you want to get in touch with us, you can go on our website. There'll be a link just down below for that, or you can click on the link which says that you want us to contact you, and we'll actually get back to you if you fill out the form. Alright, thanks again for your attention, have a great day, and we'll talk to you in the next video.